is now stepping out of Rideau Cottage, and we're going to take you there now live to hear from Prime Minister Justin Trudeau.
Coming is very important to many Canadians. Whether you mark Good Friday or Passover, Easter, Tamil New Year, or Vaisakhi, usually this is a time we spend together. You might go to church or to temple or to volunteer. Last year, when I served a community lunch in Hamilton, I saw just how much people come together over these next few days. But right now, this weekend is going to be very different. You'll have to stay home. You'll have to Skype that big family dinner. And the Easter egg hunt, well, it'll have to happen around the house instead of around the neighborhood. I want to take a moment on that to have a word with kids out there. The Easter Bunny has a big job to do this year, and maybe there's something you can do to help. Ask your parents to let you put up a picture in the window to bring some extra chocolate for nurses and doctors. They need a lot of energy to keep us all safe, and this is how you can help them to do their job. Peu importe notre âge, on a tous notre rôle à jouer.
Regardless of our age, we all have a role to play to counter coronavirus. Earlier this week, I mentioned that Health Canada had launched an appeal for volunteers to help the frontline workers. Over 27,000 people have registered to help so that they can have some respite. Throughout the country, many people are doing their share, and I would like to thank everyone. You're there for each other, and I know that together we will go through this hard time.
But you don't have to go through them alone. If you've lost your job and are having troubles making ends meet, you can apply for the Canada Emergency Response Benefit. Millions of people have already had their claim processed, and they're getting their $2,000 deposit. Remember, you can apply today or this weekend if you haven't done so yet by going to canada.ca or calling 1-800-959-2041. If you own a small business and are struggling to pay the bills or pay your staff, we launched the Canada Emergency Business Account yesterday. You can now get a $40,000 interest-free loan through your bank or credit union. And if you repay it within 2 years, 25%, up to $10,000 of that loan is forgivable. It'll only take a few days for you to receive the full amount in your account. That's money you can use for whatever you need, whether it's monthly expenses or paying employees. On that note, we're getting closer to implementing the wage subsidy, too. We're working with other parties to get this in place as quickly as possible. Tomorrow, we're bringing back the House of Commons to pass the largest economic measures Canada has seen since World War II. It's really important, despite a time of crisis, in fact, because of a time of crisis, that our institutions remain strong and our democratic principles continue. Therefore, this address to Canadians tomorrow will be a little later and from the floor of the House of Commons. And on that note, I'll be taking Sunday and Monday with Sophie and the kids, but I'll be back Tuesday with more updates on how we're helping you. If you just feel overwhelmed, we'll soon have more to say about how you can access resources that can help. If you're in crisis, reach out, lean on each other, and know that we will get through this together. All across the country, there are stories of people stepping up to do their part. To ensure that Canadians are safe and our frontline workers have the support they need, we're helping companies join in the effort. Look no further than Fluid Energy from Alberta. They will produce over 1 million liters of hand sanitizer each month, with shipments starting as early as next week. We've invested in this large-scale production as part of our plan to have enough vital supplies produced right here at home. When Canadians work together, we get things done. Hier soir, je me suis entretenu encore une fois avec la vice-première ministre.
Last evening, I spoke with Chrystia Freeland and the premiers of different provinces and territories. We are all on the same page, and we're all working together to ensure your safety. During the long weekend, we will all have to stay home. we can't have gatherings for dinner, and we'll have to be creative to organize an Easter egg hunt inside the house. But it's not because we're physically separated that we can't be there for one another. We can organizing a dinner over Skype, call your friends, and you might want to make a donation to a charitable organization. Easter weekend will not be like it normally is, but I know that it can be filled with joy, laughter, and love. Thank you.
Floor for questions. Go to the phone line. One question, one follow-up. Operator.
Thank you. Merci. First question, Mike Blanchfield, the Canadian Press. Line is open.
Good morning, Prime Minister. Happy Easter, and whatever else is on your plate. G20 energy ministers are meeting today, as you know, and I'm just wondering what Canada's plan is for playing its role with other countries in the G20 after what OPEC did to cut production and to try to boost oil prices. What's Canada going to be doing?
Canada is part of the discussion, obviously, with the G20 energy ministers. Minister O'Regan is sharing our perspective and the challenges that we're going through in Canada, from Newfoundland to Alberta and Saskatchewan. We're going to continue to work because we recognize that this is a global challenge for many, many different countries, and having a concerted approach is extremely important. We noted what the OPEC countries did yesterday, and I know that's going to be a subject of discussion at the G20 energy meetings conversation today. Okay. Nous faisons partie de cette conversation.
We are participating in this discussion with the G20 energy ministers. Yesterday, we noted what the OPEC countries took as a decision. The discussions are ongoing. We know that Canada is strongly affected by oil production.
Prime Minister, so what do you see Canada doing? Do you see it cutting production along with these OPEC countries? If so, what effect would that have in Canada?
As we know, Alberta has already curtailed production and has for some time now. We're going to continue to look to make sure that other countries are doing their part and that people understand that the most important thing through this is to ensure that families and workers across the country and indeed around the world are getting the support they need to get through this crisis safely.
Next question, operator.
Thank you. Merci. Prochaine question, Marie Vastel, Le Devoir. À vous.
Hello, Mr. Trudeau. I'd like to come back on this conference call that you had with the premiers yesterday. You spoke about the possibility of invoking the Emergency Measures Act. This is to distribute medical equipment throughout the country. You say that provinces are doing a good job, and you're asking them to collaborate and send equipment to the hardest hit places. So if I understand, do you think that collaboration between the provinces is starting to fray? No. Collaboration is ongoing and is even improving between the provinces. We see that this is a historic moment. All provinces and territories are aligned together and are working together. As for the Emergency Measures Act, there are requirements that are very stringent with regards to consultations. And so we are undergoing this process in case we would have to invoke the Emergency Measures Act. We don't need to do that right now, and we hope that we won't need to. The way that our country works is that provinces have emergency measures that have been implemented. If those emergency measures were not sufficient, the federal government has an Emergency Measures Act that can be added. At the current time, this is not necessary, and we hope that it won't be. A follow-up question. This Emergency Measures Act, could this, well, still coming back to supply issues with regards to PPE, could this allow to centralize the purchase of PPE and to increase the purchasing power And to reduce the issue with regards to supply is not a buying power issue or a cost issue. Costs are on the rise. The reality is that different provinces and even different hospitals have connections with producers globally, and they're using these connections, these contacts, to try to obtain the equipment that they need, in addition to all the efforts that are being made by the country and different provinces. It's not a bad thing for everyone to be looking at what they can do while making sure that there's a coordinated effort and there is a coordination effort that is underway. There's a lot of collaboration, and for that, we don't need to implement the Emergency Measures Act. This collaboration is very strong right now.
Thank you. Merci. Next question, Steve Shear, Reuters. Line is open.
Hello, Prime Minister. Good morning. There's a story out today saying that the Bank of Canada Governor Paulos was not asked to extend his mandate, and I was wondering. I know there's a selection process in progress, and that it's not over, but ultimately it is the government that decides. I'm just wondering if you think it makes sense for the current governor to stay on a bit longer to help underpin confidence during this crisis. Thank you.
This is an extremely important question because we know the important role that the Bank of Canada has in leading on monetary policy that is an essential part of our handling of this economic crisis related to COVID-19. The government has many fiscal measures, but a strong Bank of Canada is essential in getting us through this as well. And Governor Paulos, as always, has done an extraordinary job and continues to do an extraordinary job. The process is ongoing and decisions haven't been made as to what the next steps are.
We recognize that it's very important for the Bank of Canada to play a central role when it comes to Canada and our response to this economic challenge of COVID-19. Governor Paulos has done a wonderful job, and he demonstrates a high level of excellence during this huge challenge. With regards to succession, no decision has been made yet.
Yeah, if I could just follow up, can you give us an idea when that decision might be made?
The discussions and reflections are ongoing.
Thank you. One more question, please, operator.
Thank you. Merci. Prochaine question, Catherine Lévesque, La Presse canadienne. À vous.
Oui, bonjour, Monsieur Trudeau.
Hello, Mr. Trudeau. I'd like to come back on the Emergency Measures Act. In what case would you invoke this? There are different scenarios that have been discussed with the provinces, whether it be supply challenges or seeking to restrict the movement of Canadians even more. There are different measures that could, in theory, be looked at. These measures are not necessary at the present time. If we look at the way the provinces are able to make their decisions and are able to implement the measures that they need to do, the tools that the federal government has, for example, the Quarantine Act, means that we hope that we won't have to invoke the Emergency Measures Act, and this would be our preference.
There are a number of tools that the Emergencies Act provides for, much stronger controls on distribution of necessary medical supplies and equipment, for example, or further restrictions on travel or on Canadians' freedoms. But as I said, the way our country works is that provinces have Emergencies Act that they can bring in with very strong measures that they have all done. If at one point those measures are insufficient to do the things that are needed to do, and all the tools that the federal government has at its disposal are insufficient to bring forward measures that are deemed necessary, then and only then do we consider the Emergency Measures Act. But as I've said, it is our hope that we don't have to use it ever. We are seeing that the collaboration, the partnership among provinces and territories, and the way we're moving forward on this means that we might not ever have to use the Emergencies Act, and that would be our preference.
Une suivi?
Oui, donc ça fait presque un mois que votre gouvernement a débloqué.
Your government has begun measures over a month ago. What have you learned over the past few months?
Ce qu'on a dû faire dans le dernier mois,
What we've had to do is to go extremely fast, to create new methods, new programs, to deliver assistance to a huge amount of Canadians. Our capacity to do this has been tested over the past few weeks. We were able to do a lot to make sure that Canadians would receive assistance this week. We recognize that each time we want to go quickly to help as many people as possible, as quickly as possible. There are things to be improved afterwards, and we're working on that. I think that this demonstrates the extent to which our civil service is resilient, and they're able to deliver in extremely challenging circumstances. This will give us a greater amount of comfort. We will be able to implement appropriate measures, might be new measures, but we've been able to demonstrate that we're able to react quickly when the need is there.
One of the things we've learned over the past month is that when it needs to, government can move very quickly to help Canadians. We've seen the money from the CERB flow last week into Canadians' bank accounts across the country. That was a monumental task for our public service, for hardworking Canadians across the country who make sure that they are serving Canadians with the best that they have. And I think that lesson that when it's necessary, we can move very, very quickly and nimbly as a government is one that should inform reflections of a government going forward.
Prime Minister, Rachel Haynes here from CTV National News. You've said a number of times that testing is an essential way to flatten the curve, and you spoke to Premier Doug Ford yesterday, who has also pushed for more testing in Ontario. But at the same time, we do know that there still remains a number of shortages when it comes to testing kits. How long will it be until every person who needs a test right now is able to get one?
We are continually ramping up our testing. We started earlier than other countries in terms of intensifying our testing programs. Certain jurisdictions are doing extraordinarily well on testing, like Alberta and British Columbia. Quebec is coming a long way very quickly, and Ontario is addressing some of the challenges that they've faced over the coming days. We know there is more to do, but we can certainly know that the lead that we've taken on testing is part of why we are seeing a flatter curve than other places. We've done significantly more tests in total than the United States has, and they're 10 times the size of us. So we know that Canada's testing regime has been good, but absolutely can get better, and we're going to continue to develop more testing kits, faster testing, because we know that even as we get through this first wave of COVID-19, once we are able to get into those coming months where we will be on guard but not as shut down or paused as we are right now, testing rapidly and efficiently of as many people as possible will be a key part of that path forward. Okay. Nous avons fait énormément de progrès en matière de dépistage.
We've made huge progress with regards to testing over the past few weeks. We knew from the beginning that testing for the virus was essential as a strategy to reduce the spread of COVID-19. Each and every day, we are improving our testing protocols. In BC and in Alberta, they are doing a lot of testing. Quebec has improved significantly over the past few weeks, and Ontario is addressing real issues that they've had with regards to the testing program. We know that there remains a lot to be done, and we're going to continue. This is going to be an essential part of going through the coming year without having the current restrictions, but also having the ability to limit further spread of the virus. We have tested a lot more than in the U.S. They are 10 times our population, and we've still done more tests. We know that we have to do more, and we will.
Past few weeks, you've made a number of announcements about Canadian companies and retooling facilities in order to ramp up domestic production. And you just said in one of your previous answers that the government can move quickly when it needs to. But there are still a number of Canadian companies who say that they can supply this medical equipment, but they're either getting caught in red tape or haven't heard back from provincial or the federal government. So how long will it be until these domestic supplies make it to the front lines and into hospitals?
We've had thousands and thousands of Canadian companies step up and offer to be part of supply chains for essential services, for essential equipment and medications. We are working with all of them as quickly as possible. There have had to be choices as to who we could move quickest with, who was furthest along, but we will continue to work with all companies who put up their hands to be helpful, to figure out ways they can best help. This is something in which all Canadians can pull together and are pulling together, and we will continue to do that.
Hi, Prime Minister. Crystal Oak with Global News. Is the federal government considering any measures, such as regulation or federal oversight, to ensure long-term care facilities are protected from this or future pandemics?
There have been a number of reflections and discussions on this. We've seen that British Columbia has taken strong steps to ensure the safety of long-term care workers and residents. Obviously, this is a point of vulnerability, as we've seen throughout the country in terms of the impact of COVID-19. We're continuing to work with health professionals and medical experts to make sure we're doing everything we can to protect our seniors.
We recognize that nursing homes for seniors and long-term healthcare facilities are places where infection can spread. Our seniors are more vulnerable, the workers are more vulnerable, and that is why we're looking at different proposals, including the proposal from BC, to make sure that our seniors are as protected as possible during this difficult time.
Is that a concern for the federal government, and what is being done to help protect them?
Of course, we are tremendously worried whenever a healthcare professional contracts the virus. That is why providing adequate and significant amounts of personal protective equipment, making sure that protocols are being followed, helping provinces adjust their medical systems in ways that protect our healthcare workers is absolutely essential. We need our healthcare workers not just to stay healthy for their own benefits or the benefits of their families, but we need them to be able to stay healthy for the benefit of our entire community. But we also need them to know that we have their back as they don their protective gear, as they go into battle against this virus for the rest of us. We need to make sure they're getting all the support they need, because they are the ones that are going to save Canadians.
We recognize that it's very important to provide all the help, all the PPE, all the help possible to our frontline workers. That's why we're working so hard to make sure that we have a coordinated approach, that they'll have the equipment that they need, and that we are able to protect the workers in the healthcare system. We recognize that they need to be protected not only for themselves, their families, but people need to know that we're there for them. They are going to be fighting against COVID-19. They are on the front line. They are the most at risk to ensure our safety, and we have to be there for them. We need to recognize all their hard work and make sure that they continue to do this extremely important work that they're doing for us.
A briefing note prepared for your Minister of Health on March 10th actually said that the risk of the spread of the virus within Canada remains low at this time. How do you explain the misinterpretation of the threat of the pandemic at such a late stage?
I think we saw that within days we'd begun to take very serious measures to restrict travel, to encourage social distancing. We moved very quickly and earlier than some countries on countering the potential spread of the virus. At those days, the numbers of Canadians infected were still low, but we saw the potential that we are in right now, and we started to act early. And that's why the measures that we're taking right now, the significant measures that we're in right now, are keeping us, we are hopeful, on the best possible curve to get through this in the coming months. Okay. Nous avons reconnu que ça commençait à devenir de plus en plus grave. Et le potentiel...
We saw that the potential was there for a more severe impact throughout the country. That is why we acted quickly to limit traveling, to encourage people to engage in social distancing. And we took important measures that made sure that the impact in Canada was lessened and was slower than in other countries. We're going to continue to take the necessary measures so that the impact will be lessened. And
advice that there was a low risk of the spread of this flawed, and what impact did that have on your government's work to contain the virus?
Our work continued every step of the way, informed by the recommendations made by our health officials. We wanted to both make sure that there were no panics on Canadians, while at the same time getting people to take more and more significant measures, because we knew that the behavior of Canadians was the strongest way of doing what we've been able to do so far, which is slow the spread of the virus, delay it beyond where it's been in other countries, and give us the best possible chance of getting through it. As we look back, of course, there's going to be things we said, oh, we might have said this differently or that differently. There's going to be an awful lot of learning through this. But it remains that as we get through this now, as we live through the measures that we've put in place and lean on each other and hold together, we have the best chance of getting through this in the coming weeks and months by remaining true to the advice that experts are giving us, to stay home, to keep 2 meters apart, to wash our hands regularly, to not go outside unless we absolutely have to hunker down, lean on each other virtually and metaphorically, and be able to support each other through this time. Nous reconnaissons qu'il y a toujours des façons de dire on aurait pu faire ceci, on aurait dû faire ça.
In hindsight, it's easy to say that we should have done things differently. The reality is that we acted quickly and we took measures to slow the spread of the virus in Canada. If we compare with other countries, we are on a track that should allow us to get out of this pandemic more quickly than other countries. And we need to continue. We have to stay home. We have to continue with social distancing, to not go out unless it's essential, to wash our hands frequently. These measures will allow us to go through this pandemic in the best way possible, and also to rebuild our economy as quickly as possible. Yes, on the economic crisis, yesterday François Legault was saying that soon some sectors of the economy would be able to open up again. And you were saying it would take a year and a half before finding normal. So on a federal level, are there some sectors of activity that will be able to open up again soon, and which ones? We cannot talk about a return to the normal, before we have a vaccine against COVID-19. But there are many things that we can do. We can we can let up on some measures after having gone through this first wave. In our models, we can see that this lessening might be able to begin, or this lessening might begin this summer. But during this pandemic, we have to live with some measures to keep us safe, to minimize the risk of a resurgence and a second wave of COVID-19. So we're not going to go back to normal as it was before COVID-19, before we have a vaccine against the virus. But there are different sectors of the economy, different economic activity that will be able to start up again once this first wave is over. And we are in discussion with the provinces and with different industries, with healthcare experts, and our science experts as well. We're trying to determine where we can let up and how we can recover gradually. I agree with Mr. Legault. We should be able to do this in the weeks and in the months to come, but we also have to think about this very carefully and coordinate on how. It can be quite discouraging. Yesterday, when you said it might take a year and a half for a vaccine and for life to go back to normal, when you talk about economic sectors that might start up again, what measures could be in place for a year and a half? What are we talking about? People over the weekend are trying to understand. They're trying to understand what to expect in the months to come. We are in phase 1 of the virus. Right now, there is a spread of the virus throughout the society. It's concentrated in some regions, but we're all vulnerable to COVID-19 right now. We are taking measures, for example, staying at home, to not go to work if we can work from home, to not go out unless it's for essential things. People know full well what the situation is right now. People have seen our economy be paused, and our lives have been put on pause, and this needs to continue until we go through this first wave of COVID-19 cases, and this should be the worst wave. Afterwards, we will be able to lessen up on some measures. Maybe more people can go to work. Schools might begin to reopen. Economic activity might start up again. But we would do this in a gradual way in order to maximize our safety measures and minimize risk of having further spread of COVID-19. At that time, we will have developed better protocols for testing. We will have technical and technological capacity to do contact tracing rather, and we will be in a much better position when it comes to limiting other peaks with regards to infection rates of COVID-19. We're not going to go back to normal as we knew normal to be, but we'll be able to do many things that we cannot do right now and that we'd like to do. There will be continued vigilance up until the availability of a vaccine. When will this be? We don't know. It could be in 6 months, in a year and a half. We don't know. We don't know how long this is going to take. Our researchers are working on the issue. What we do know, though, is that our ability to make sure that this first wave will end this summer depends entirely on us, on citizens, on people who continue to stay home, continue with social distancing, continue to do what we're doing right now for many weeks to come. And we might talk about easing up on the measures during the summer.
What we are in right now is the first phase of the spread of the virus. This is the phase that runs to a certain extent unchecked or difficultly checked through our society, through our communities. We're seeing new cases pop up here and there. We're seeing people struggle to handle it and to keep these measures from overwhelming our healthcare system. If we do things right, this will be the first and worst phase that we go through as a country in terms of COVID-19. If we keep these measures, these strong measures in place of staying home, of not going outside unless we absolutely have to, on keeping 2 meters apart, in being strong about social distancing, these are the things that will ensure that we will get through this first wave of the virus as quickly as possible with minimal loss of life as well. This is what we're looking for, of not overwhelming our healthcare system. And that happens if we stay strong about remaining at home for the coming weeks. According to the models we've put forward, it is possible that we will be able to be out of that wave this summer. And at that point, we will be able to talk about loosening up some of the rules that are in place, looking at particular sectors where people can go back to work, bringing in new rules around how people can interact with each other in society and get things rolling again. We'll have to be very careful about how we do that, and we will have to remain vigilant and active every single day for possible resurgences of the virus. At that point, however, we will have developed much better testing protocols because every single day we're improving them. We will develop new technologies for contact tracing, and we will all become much better at reacting when a possible resurgence happens. So as we look at possible resurgences over the coming months, we will be better adjusted and adapted as a society to minimize them and therefore minimize the disruption to everyday life, to our economic activity. That is the ideal scenario. But it only happens if we continue to stay strong for the coming weeks and stay, inside, keep those 2 meters apart, and be very careful about not allowing COVID-19 to spread further. That phase of vigilance, of easing off to a certain extent, but still being careful, will continue until such a time as we have a vaccine for the virus. Researchers across Canada and around the world are working hard on this. It could take as little as 6 months. More likely it'll take a year or a year and a half, maybe even longer, but I know the best minds are working on that. So we will, once we're through this first phase, be able to get back to something that is more normal, but we will not get back to the normal that we had before, at least until we have developed a vaccine for the virus. That is the reality, but the fundamental bottom line that people can reflect on this weekend is if we stay strong in our social distancing measures now and for the coming weeks, we can see how things can start getting back to normal in the coming months, and we will be able to get through this because that's what Canadians do. We lean on each other, we support each other, and we figure out how to get through the big challenges that life throws at us. Merci beaucoup tout le monde. Have a wonderful Easter.